Hello, thank you for tuning into the Natural Health Rising podcast. My name is Rachel Smith. I am a certified functional diagnostic nutrition practitioner, and I've helped hundreds of people naturally reverse symptoms of autoimmune diseases and other health challenges, from digestive issues to hormone imbalances. And in these weekly episodes, you're going to learn from myself and top health experts from around the world about functional medicine and holistic health tips to help you rise to your healthiest, happiest self. So, in this episode of the Natural Health Rising podcast, I have Dr. John Neustadt with me. So, Dr. John is a naturopathic doctor who is the founder and president of Nutritional Biochemistry Inc., or NBI. Dr. Neustadt earned his naturopathic medical degree from Bastyr University, where he was awarded the Founders Award for Academic and Clinical Excellence. Dr. Neustadt has published more than 100 medical articles, written 4 health and wellness books, and is now a #1 Amazon bestselling author in the field of osteoporosis. His most recent book is Fracture Proof Your Bones, a comprehensive guide to osteoporosis. Dr. Neustadt was also an editor of the textbook Laboratory Evaluations for Integrative and Functional Medicine, which was used across the United States to train and educate physicians on using functional medicine with their patients. Welcome to the show, Dr. Neustadt.
Thank you. I'm excited to share what I've learned, and hopefully people can take away a few pearls here and there to help themselves with.
Yeah, that's what we hope. Quite the bio there as well.
Thank you.
Well, since you are really an expert on osteoporosis, I'd love to dive super deep into that topic today. And I'd like to just really start with the basics for people. What is osteoporosis and how does someone develop this in the first place?
Osteoporosis is a disease of the bones where they are progressively becoming weaker, and that increases a person's risk for fractures. 80% of osteoporosis occurs in women and 20% in men. It predominantly happens as people get older. When we're young, we're building bone, and the peak bone mass occurs in our 20s, and then set steadily over the subsequent decades, bone can begin to lose bone density and become weaker. When a woman hits menopause, and for the 10 years after, is the fastest rate of bone loss. And it's a very dangerous condition. If you have osteoporosis and break a hip, there's up to a 36% chance that you're going to be dead in a year. If you happen to survive, those people who survive, about half of them never regain their full pre-fracture level of mobility and pain-free life that they had before. And in fact, osteoporosis causes more days spent in a hospital than other conditions like heart attacks and diabetes and breast cancer. And a woman's risk for an osteoporosis fracture is greater than her combined risk for breast, uterine, and ovarian cancer. And yet there isn't a celebrity backing where people are wearing these pink ribbons, walking around and raising money for osteoporosis. But it's a condition that we are really looking on the cusp of a huge wave of new cases, because in the US and around the world, there are more people over the age of 65 now than there are younger than 5 years old. And unfortunately, there's also a long list of medications that damages bone and increases the risk for osteoporosis and fractures. And one of those medications in particular is primarily prescribed to women, and those are the antidepressant medications. And that is a risk that most physicians aren't aware of, and they don't realize that what they're doing is actually damaging bone and increasing osteoporosis and fracture risk. And so one of the things I'm passionate about is teaching people about the risks for this disease, what they can do not only to prevent it, but also to promote their bone health once they have it and reduce their risk for fractures.
Wow. Okay. So when someone's taking an antidepressant medication or these other medications, what's happening there? Is it depleting the body of calcium or blocking something? How is that actually creating this increased risk of osteoporosis?
Great question. It depends. The mechanism of action depends on the medication, and so each medication will affect bone differently. The category of antidepressant medications that I'm talking about are any of those that increase serotonin. So, like the SSRIs, Prozac is the common name that I think everybody knows.
Mm.
There are serotonin receptors in bone. People have heard of serotonin usually as the happy hormone, one of their happy hormones that is produced in the brain. But the majority of serotonin, 90% of serotonin, is actually produced in the intestines, not in the brain. And people are surprised to learn that's also the case with melatonin. Most melatonin is not produced in the brain either. In your bones, that there are two primary cells in bone. One are called osteoblasts and one are called osteoclasts. The osteoblasts build bone up, they create new healthy bone. And osteoclasts, they break old bone down. And that process is called remodeling. And we need it. About every 10 years, you have complete remodeling of your bone and you have all new bone. In osteoporosis is essentially when that balance is off, you're out of balance, and the osteoclast, the amount of bone breakdown, is happening faster than you're building new bone. And what happens is when serotonin is artificially increased, it accumulates in the bone, it attaches to those cells, and it increases the osteoclast activity relative to the osteoblast. So the osteoclast activity goes up, the osteoblast activity go down in relation to each other. And so you're getting more and more bone breakdown. And that's how that category of medications reacts. Acid blocking medications or proton pump inhibitors, that's another category of medications that increases fracture risk. And I might add with the antidepressants, there have been many studies done on this. One that looked at, they gathered up the research. It's called a meta-analysis, where you review published clinical trials and pool the data to verify it, look for trends, determine that for every 19 patients taking one of these SSRI medications, we would expect one person to have a fracture. So it's really quite a serious situation. With the acid blocking medications, what you're doing is you're depleting your ability to digest and absorb nutrients, because stomach acid is one of the first steps involved in breaking down digesting nutrients, and so you can absorb them. And when you block your stomach acid, then it increases it increases the risk for quite a few different nutritional deficiencies. And that's what's thought to promote or to cause the damage to bones and increase fracture. So much so that after 4 years of taking an acid blocking medication, there's an association with an increased hip fracture risk of about 40 to 50%.
Wow, that's huge. Okay. So at what point can someone or should someone start testing to see if they have osteoporosis, and what does that even look like?
So it depends on the case. So for the vast majority of people, the recommendation is for women who are 65 years old to get tested, or older, or if younger than 65 and postmenopausal to get tested. Men 70 years old or older to get tested. That's the U.S. Preventative Services Task Force recommendations. But the Bone Health and Osteoporosis Foundation, I think, has a better, more nuanced approach. And that is, if you're 50 years old and you break a bone, whether you're a man or a woman, you should get tested. Because that often is the event that occurs that causes someone to get tested, and then they end up getting diagnosed. The majority of people who are eligible for screening for osteoporosis, in fact, aren't even getting tested. So that's a real weakness in our healthcare system that hopefully will improve. There are other people who it is recommended that they get tested as well. Those who are at increased risk due to, for example, medications. If you're on an aromatase inhibitor, which blocks estrogen production, it's often prescribed for women with breast cancer. That the recommendation is that you get a baseline screening before starting that medication, and routine screening while on it after that. There's a 20% increase in fractures for people taking aromatase inhibitors over 5 years. So it's quite a also important thing to be aware of and talk to your doctor about if you're taking a medication.
Mm-hmm. So yeah, I did want you to touch a little bit more on the hormonal piece, everything, because you said as women get into menopause, so this is the lack of estrogen is what is the main component to creating this osteoporosis, correct?
Correct.
Okay. So,
But however, it's important to know that 30% of postmenopausal osteoporosis is due to other things. So just because somebody has gone through menopause and then gets diagnosed with osteoporosis, 30% of those women are going to have something else that's causing the osteoporosis, whether it's a medication or another disease. Inflammatory diseases like irritable bowel disease also create osteoporosis. Autoimmune diseases can increase the risk for osteoporosis. Cancer can increase the risk for osteoporosis. So it's important to get a full screening, even if the answer seems so simple as, oh, I've gone through menopause, I have osteoporosis. That's the explanation. Well, there may be something else in addition to that going
mhm,
on.
mhm. Okay. So you've talked, can you talk a little bit about what is the conventional approach to osteoporosis? And then what would a different approach, more of like the whole person, more holistic approach look like?
The conventional approach is to look at a bone density test result. The bone density test, or a DEXA scan, people may have heard of that. That's an X-ray that goes that a woman, most it's usually women, but people get tested with a bone density test, and it's an X-ray. The X-rays go in, they bounce off the minerals in the bone, and the machine detects that, and it spits out a number. That test result is what's typically required to diagnose osteoporosis. It tells you if you've got bone loss. It gives a T score. A T score compares your bone density to somebody in their 20s of the same sex and race. So if you are a 62-year-old Caucasian woman, then your bone density is going to be compared to a 20 to 29-year-old Caucasian woman. And so when it drops down low enough, a T score, they're reported as negatives, minus, because you're losing bone density. So minus 2.5 or lower, that's diagnostic of osteoporosis. A -1 to -2.5 diagnoses somebody with osteopenia or pre-osteoporosis. And I tell you all of this because typically the only thing that's treated conventionally is the number on that test. That's what the doctor's looking to change and improve. And the whole reason why I got into this field, the origin story, kind of my background of why I specialize in this, is because my mother-in-law has osteoporosis and she was taking Fosamax. She was working with her conventional MD, and I was helping her a little bit, but I wasn't really treating her. But her bone density was going up. So her doctor was happy. She was happy. I was happy at the time because that's all I knew. And then she tripped and broke her hip. And I thought to myself, what is wrong with this picture? So I started diving into the research. And it turns out that a bone density test is not a very good predictor of fractures. It only predicts 44% of women who will break a bone and only 21% of men. And yet that's typically the only thing that's treated and monitored. They're treating the number on the test and not the patient sitting in front of them. And in fact, there are other more important predictors, more consistent predictors for somebody's fracture risk. And the reason why a bone density test does not do a better job of predicting fractures is because it only measures the mineral part of the bone. But bone is a
Mm.
complex tissue. Like all tissues, it's made up of different things. Minerals are just one part of it. Bone is truly this miraculous organ in our body. Not only does it allow us to walk around and hug our loved ones and play and do sports, but it produces our blood cells, our red blood cells, our white blood cells, our platelets. It's now understood that it produces some hormones. And in terms of what gives bone its structural integrity, its strength, you have the mineral component, but then there's the proteins in bone. There are 180 to 200 proteins in bone. And in fact, one of the major proteins is collagen, bone collagen. That's what gives bone its ultimate strength. If you were to take the collagen and totally remove it from bone, bone would be brittle like a column of chalk. It would just break apart. But if you were to take all the minerals out and you had healthy collagen in there, the healthy protein, then it'd be like a rubber chicken bone. You can do this if you want. You take chicken bones and you soak them in vinegar, and it takes the minerals out of it. And what you're left with is the collagen, the non-mineral part of the bone. And you can bend it, you can twist it, you can bang it, it won't break. Because the bone density test only looks at the collagen or only looks at the mineral part of bone, it's missing this entire other structural component because it's just not, it can't test for it. It's not possible. It misses this other structural component that is crucial for getting a better picture of how somebody's fracture risk is doing.
Okay. So with that being said, are there other tests that you do to help your patients, or how do you then approach that if you see, okay, well, their DEXA scan isn't good, or maybe it is improving, but what else is going on in that picture to prevent the bone fractures and to reverse the osteoporosis?
So unfortunately, there isn't a great single test that's going to give people the best picture. Osteoporosis is a disease where bone weakness is not always detected, or that you can't really detect it that easily on tests. So there is one other test that I like. It's called the CTX test, and that's the breakdown part of collagen. As collagen's breaking down, it releases fragments, and one is abbreviated CTX, and that's been associated with increased fracture risk. And supplementing with collagen has been shown to decrease that, but there are no outcome trials showing if you decrease CTX, you then decrease fracture risk. But a CTX, low CTX, I mean, a high CTX when combined with a low bone density has a strong predictive value for fractures over just the bone density test alone. And unfortunately, there just aren't great tests out there. 95% of fractures occur because somebody falls. So the greatest test for whether somebody is at increased risk for fractures is just looking, evaluating, testing their mobility by just watching them walk. Do they have a hard time walking? Are they not steady on their feet? Can they get up from a seated position easily out of a chair? Can they stand up from the floor unassisted? Things like that are important, because anything that increases the risk for falling is going to increase the risk for fall related injuries, which includes fractures. Unfortunately, though, in a conventional medical setting, the number on the test, that bone density test result, is typically the only thing that's being treated. And if somebody is being recommended exercise or diet or dietary supplements, it's a very cursory, maybe one sentence. The conventional docs are not trained to have those longer, more involved conversations about what they look like. And people are just sort of sent off typically to figure it out on their own.
Mm-hmm. You
And then, and
mentioned,
if there is a recommendation, I'm sorry, it's we'll eat, take calcium and vitamin D.
right.
That's about
So,
it.
okay. So then, from your perspective, I mean, what are you doing? I want to know more about, actually, I have a question about collagen first, which is what type of collagen? Because there's all these different
Type 1
types, right?
collagen. Type
Type
1 is what's in bone. And so
type
typically you'll
one.
find it as It's come from bovine collagen, and typically it'll be types 1 and 3 combined, because that's what comes from bovine, from cows.
Hmm. Okay, awesome. And then, so outside of the calcium and vitamin D that someone may be recommended to get, what really needs to be done to help these people from a nutritional standpoint, whether that's with whole foods or, if they can't get in through their diet, what do they need to supplement with?
So the foundation of health is always the same, regardless of your age, whatever diseases you have. It's diet and lifestyle first. That's the foundation for health. With respect to osteoporosis, unambiguously, the dietary pattern that's been shown to be the healthiest is the Mediterranean style diet, or Mediterranean dietary pattern, which is a plant forward diet, very high in fresh fruits and vegetables, whole grains, legumes, lean proteins like fish and chicken, very low in red meats, maybe a couple times a week, and definitely in the smaller quantities than what we typically have in front of us when somebody orders a steak in the US. Very low in packaged foods. It's essentially the opposite of the standard American diet. The standard American diet is pro-inflammatory. It creates inflammation. It increases the risk for nutritional deficiencies, increases the risk for diabetes, osteoporosis, cancer. The risk goes on. The list goes on and on. The flip side of that is that Mediterranean dietary pattern, which has been shown to reduce osteoporosis risk by 20%, or has been associated with that reduction in osteoporosis. It also has been shown to reduce the risk for diabetes, obesity, heart disease, cancer, death from cancer, all cause mortality, which includes dying from cancer and includes dying from osteoporosis. And so it's that dietary pattern that I recommend. And in my book, there's a whole chapter on diet, and I've distilled it down into two very simple things. And that is, if you focus on plants and protein, you're doing good. Like, that will get you there. If you're eating 30 grams of total fiber during the day, and for that fiber comes from whole foods, plants, vegetables, and fruit, and then making sure you're getting enough protein. And what I find over and over is, despite the high protein keto diet craze that's going on right now, repeatedly when I do diet recalls with patients with whom I'm working, they are not getting enough protein. And the USRDA for protein as people get older is insufficient to actually maintain that muscle mass that's important to prevent somebody from falling, to keep them steady and strong. And so making sure you're getting enough protein, and there's a calculation in my book, and how can you track that? So it's plants and protein. That's the Mediterranean pattern that the research shows is the best for bones. Then with respect to lifestyle, sleep is crucially important and doesn't get enough press, I don't believe, when it comes to osteoporosis. As people if you're not getting enough sleep, if you're averaging less than about 6 hours of sleep a night, you're increasing the risk of osteoporosis. The rate of bone loss is faster in those people than people who are getting adequate amounts of sleep. So working on your sleep. Fitbit did an amazing study years ago. They looked at billions of data points, and they found that the most consistent predictor of healthy sleep was going to bed at about the same time every night. And so if you do that, and if you need some help, then there are supplements that can help. Getting off your screens about an hour before bed may help as well. Journaling can help if you're tossing and turning because your mind's racing. There's lots of things you can do to improve your sleep. So I talked about diet. I talked about sleep. Exercise is important. You don't have to go to a gym. Gyms are great. You want to increase your strength and your balance. That's the goal. And there are different ways to do that. There is, Pilates. There, of course, is the gym. There's yoga. There's P-Volve. There is even just going for a walk is shown to be healthy. And you don't have to walk 10,000 steps a day. That's a myth. The research shows that if you walk an average of 7,000 to 7,500 steps a day, that's associated with a 50 to 70% reduction in all-cause mortality, which, again, that's death from any cause, including osteoporosis. So just going for a walk, gardening is phenomenal. There's lots of options. Just think of it like a buffet table and do what sounds good to you. get moving your body. Those are the foundations. Then you get into, or I get into the concept or the idea of supplementing. And it's similar to the idea of the testing that I talked about, in the sense that it's important to always ask the question when it comes to osteoporosis: how well does this relate to fractures? Meaning, if it's a test, how well does it predict my fractures, if it's, or my risk for fracture? And if it's a supplement or even a medication, the important question to ask is, has it been shown to reduce fractures in people with my condition? Has it been shown to maintain strong bones in people with my condition? When it comes to nutrients used in dietary supplements, there are only 4 nutrients that fill that criteria when it comes to bones and bone health. That's calcium and vitamin D. That's been shown to reduce fractures by about 18 to 23%. I'm a fan of testing for vitamin D. When it comes to osteoporosis and bone health, the maximum fracture reduction occurs when somebody's vitamin D level is between about 30 to 44 nanograms per milliliter, or 30 to 44 on a blood test. If you want immune boosting effects, the immune benefits of vitamin D, then that appears to be higher. We're talking 50 or 60 on a blood test. But for bone, 30 to 44, and not by itself, with adequate amount of calcium. How much calcium should somebody get is an interesting topic. The USRDA for calcium is 1,200 to 1,500 milligrams per day. The average American woman gets about 800 milligrams of calcium in her diet. The USRDA is for any nutrient, is from all sources, diet and dietary supplements. So for most women, in addition to their diet, taking a calcium dietary supplement that has maybe 400 milligrams of calcium in it will get them into that healthy range. So I talked about calcium and vitamin D. When you look then at the other nutrients, the third nutrient that's been shown to maintain strong bones is a specific form of vitamin K2 called MK4, in the dose of 45 milligrams per day. Now, if your listeners know dietary supplements and they've looked at bone support dietary supplements, they may have heard of MK7, which is another form of vitamin K2. And then there's MK4. They're both types of vitamin K2. Vitamin K2 is a category. They're different types. Those are 2 types that are found in dietary supplements, but they're not the same molecule. They have different names. They have a slightly different structures. And so while they have similar roles in the body, they have unique roles that the other one doesn't have as well. With respect to bone health, only MK4 has been shown to stop and improve bone density, to stop bone density loss and improve or increase bone density. MK7 has only been shown to slow down how fast somebody loses bone mass, slows their rate of bone density loss. But most importantly, only MK4 has been shown to maintain strong bones, as indicated by fewer fractures in clinical trials, over 70% fewer fractures in clinical trials, as a matter of fact. There are no clinical trials with MK7 showing that it maintains strong bones, as indicated by fewer fractures. There are no clinical trials that looked at fractures as the endpoint with MK7. So MK4 is that third nutrient, along with calcium and vitamin D. And the fourth nutrient is strontium. Strontium is a mineral, and for different reasons, I'm not a fan of it, and I recommend people avoid it. The reason why is that strontium incorporates into bone like calcium. And if you remember earlier in our talk, I talked about the X-ray, the bone density test is an X-ray. It bounces off the minerals. Well, it bounces off the strontium too. But because it's not a medication in the US, the machines in the US don't know how to correct for somebody taking strontium. The bone density test results are false. They're not accurate. Despite the limitations of the bone density test, we want them to be accurate because it does have some predictive value. We do want that as part of the overall puzzle that we're looking at. The majority, all the research, every clinical trial on strontium is on a form called strontium ranelate, which is approved in some European countries as a medication. In the US, it's only available as strontium citrate. as a dietary supplement. There are no clinical trials looking at bone density or fractures or safety of strontium citrate. None. But what we do know with strontium ranelate is that for every one person who is, for every one fracture that's prevented, it is going to create one blood clot that can create a heart attack or a stroke.
That's not
And so
good.
for those, so for those reasons, I'm not a fan of strontium. When you can get, over 70% increase in bone strength with just the MK4 and the calcium and vitamin D, that's phenomenal. In fact, MK4 has been so well studied that it's been approved since 1995 in Japan by the Ministry of Health in Japan for bone health. So those are really, when I'm looking at dietary supplements for bones, it's a very targeted approach. It's question is, what does the research support? What has been shown to maintain strong bones as indicated by reducing fractures? And the top three nutrients of that list are calcium and vitamin D and MK4, 45 milligrams per day. Now, there are tons of products out there in the market, many other nutrients in them. You'll see boron, you'll see magnesium, you'll see silica, all this stuff. None of them have been shown in any clinical trials to reduce fractures. And what's important to know is, like, I'm a fan of supplementing when people need it, but I also don't want people to just flush their money down the toilet. It should be a logical approach where you're getting the most for your money. Magnesium is a great nutrient, and it should be in a multivitamin in a healthy amount. And if people are eating the Mediterranean style diet and they're eating lots of good healthy fruits and vegetables, they're going to be getting a lot of magnesium anyway. So diet first, supplements to supplement. Supplements, in my opinion, should be used as the FDA intended. That is to supplement a healthy diet. So I continue to go back to diet, and then supplements should be used very specifically in specific situations and conditions where the research supports it.
Mm-hmm. Definitely agree there. I have a few follow-up questions for some points that you've made. So really quick, going back to the diet piece, can you share, because I see this a lot too, is so many people don't eat enough protein, but for these people with osteoporosis or older people who need to be concerned about this, what is that protein formula that you mentioned that is way different than the RDA recommends?
Great question. It's just more than what the FDA recommends. So the US RDA for protein is a 0.8 to 1.2 grams per kilogram body weight per day. The research shows you really need to be above that, about 1.3, 1.4. Some recommendations go up to 2 grams per kilogram body weight per day. So to figure out how many grams of protein minimum that somebody should be getting, you take your body weight, you divide it by 2.2. That will convert your body weight from pounds into kilograms. So your body weight divided by 2.2, and then multiply that by 1.3 or 1.4, whatever the amount is. And that will give you the total number of grams, or the minimum number of protein in grams that you should be getting per day. And it can be a lot. Mine, for example, is about 95 grams of protein. And so if people have a hard time getting that much from diet, in my book, there's a two-step equation. I know math turns off a lot of people. It's really easy. Just walks people how to make this simple calculation, and then and then in the appendix, there's a list of protein foods, so you can track how much protein you're getting for a couple of days. The goal is not to track, how much fiber and how much protein you're getting for the rest of your life, but understand where you're at now versus what the recommendation is, and then transition into eating healthier and developing that habit over 4 weeks, 6 weeks, whatever it is, where it just then becomes second nature. Like your unhealthy eating is now, healthy eating can just become a habit and second nature that your body starts to crave, and you've got the right snacks around and to feed your body instead of feeding your disease. And so with the protein, it's a simple calculation. If you can't hit that, if you're having a hard time getting that amount from diet, then again, supplements can be great. I take a protein powder to supplement because I have a hard time getting that much each day. And so I'll supplement to make sure that I'm hitting what I need.
Okay, amazing. And then to touch on something about the physical activity. So obviously we want people to do what they enjoy doing. Like, right, you said gardening and the gym and Pilates and walking. But is there a higher benefit in building bone from weightlifting? Or is there, if you could choose like the best, is there a best option for people if they could pick one exercise?
So the best option is to do what you're going to do consistently, day after day, month after month, year after year, and do it safely. So first of all, there are no clinical trials that have compared one type of exercise in another compared to another in what's called a prospective study, like a randomized clinical trial. That just doesn't exist. We have different studies that associate, weightlifting can improve bone density, but also other things can improve bone density as well. So but again, it's what's going to reduce fracture risk.
Mm-hmm.
Right? It's not just a bone density story. So the best thing to do is the thing that you're going to do consistently. And also don't put yourself in a box, meaning, for me, I find that if I do the same exercise, or, after maybe a month or a couple months, I start to get bored with it. I used to just force myself. I've got to continue. I've got to continue. I don't anymore. I'm like, okay, my body's telling me I'm bored now. What can I do? What else can I do? Maybe I start hiking more, or maybe I switch to there's an app that I was doing for a while called Muscle Booster app at home. Now I'm doing P-Volve, which I mentioned. Before I was going to a gym, I used to ride my bike more. I'm just explore. It's a beautiful, beautiful life and world out there, and part of living a full life is enjoying what we're doing. And so if it's just this drudgery of like, oh my God, I've got to go to the gym, and that's why I passionately tell people, no, if you don't like the gym, it's okay, you don't have to go. There are many, many different ways to get the same benefit for your health. So pick something you love and do it safely. That's important because if you have osteoporosis, especially advanced osteoporosis, some exercises can actually increase your risk of fractures. Weightlifting, if done with poor form, can increase your risk for injury. Yoga, if you have osteoporosis and do a pigeon pose, that may increase your risk for hip fracture, because it's a lot of pressure putting on your pelvis. So again, modifying, doing things safely, maybe working with somebody who understands how to work safely with somebody with osteoporosis is important.
Mm-hmm. So let's say somebody comes to you and they have osteoporosis and they start doing all these things. They are eating the Mediterranean diet, they're doing the plants and protein. You get them on some supplements that you've mentioned so far. They start working out. What's the expectation for them? Like, how long does it take for things to change? And what do you see what happen with your patients?
So as soon as you start moving, as soon as you begin to improve your strength and your balance, you are beginning to reduce your fracture risk. As I said before, 95% of fractures occur because somebody falls. So anything we can do to prevent that will help immediately begin to reduce somebody's fracture risk. One other thing I just want to say about that and exercise, about not having to go to the gym, just doing things around the house is phenomenal. The stork exercise, which is in my book, and I love teaching to patients. If you can stand on one foot while you brush your teeth, and I'm doing it now, and you brush, 1 minute on the bottom, and then when you switch to the top teeth, you switch feet and you stand on the other leg for a minute. That's 2 minutes. You do that twice a day. You're working a little bit of your core. You're working your glutes and your quads, right? You're improving your strength and your balance. So there are things you can do that can help. Taking the stairs instead of the elevator, right? Just working it into your daily life. So what people should expect, who have worked with me, is, first of all, what I tell people to do when they come to me, because they almost always have already have the diagnosis of osteoporosis, is I tell them, and they're typically quite stressed and worried about it, is I tell them to take a deep breath. Just take a breath. Yes, this is serious, but it's not an emergency. There's time. There's time to educate yourself. There's time to put together a plan for yourself. There's time to gather your questions, to ask your other doctors the important questions to ask, especially when recommending a medication. There are specific important questions to ask to make sure you're getting the right recommendation, to make sure it's the right one for you. And so take a deep breath. And that's this labor of love of my book, was taking all of that, 2 decades of experience that I've got and research, and helping people go through chapter by chapter of how they can create a holistic plan for themselves, and with take action sections at the end of many of the chapters, so they can then better create their plan, ask the questions they need to ask, and make sure that they're on the right path. And in terms of reducing fracture risk, one of the things, it's not just about pills and powders. It's not just about exercise. The home environment is important to look at as well, to make sure that there aren't throw rugs. One of the common dangers in houses are throw rugs. People may trip on a throw rug and then they fall. So getting rid of those, making sure pathways are well lit, making sure no like furniture, low furniture, like a coffee table sticking out into a common walkway where somebody could bump into and fall over. That is a common cause of falls and fractures. Those hazards at home, and that's why there's a whole chapter dedicated to that. So what somebody should expect is, first of all, I do recommend people get bone density tests, and they get them repeated. We can't repeat them any sooner than about every 18 to 24 months. The machines just aren't that sensitive to depict those changes. And so typically people won't get tested until, for a year and a half to 2 years, they'll get that repeat bone density test. And what people should expect is on that test that it'll likely stabilize, stop declining, or even better yet, improve. But more importantly than that, because they're doing all this holistic things and these approaches that I talk about, they are going to be doing all the things they can do to reduce their fracture risk, not just improve that number on a test.
Mm-hmm. Okay. And I want to make sure we have a little bit of time to talk about supplements too, because yes, it's so much lifestyle, but these people who are, I talk to people all the time, they go out and they buy supplements and they're just grabbing whatever, right? Or, you listen to a podcast, you buy it, you are at a grocery store, you buy it. People wind up with these supplement graveyards, is what I call it.
Yeah.
Right.
Oh, I like
And
that.
a lot of times they might not have safe ingredients in them. Maybe they don't have enough of ingredients for them to be really effective. Right. So how can this be less confusing for people?
I
Um,
love this question.
yeah, go for it.
So it's a $60 billion industry. So there are good actors in that industry and bad actors. And it's my industry. I own a dietary supplement company. When I
Mhm.
couldn't find the combination or dose of nutrients shown in clinical trials to work that I needed for my patients, I created those solutions because I needed them to help my patients. So this is not theoretical for me. My supplement company MBI has been in business since 2006, and this is how I do business, and this is how I teach people how they can evaluate companies and products. So first, look for citations on the company website. There are a lot of claims that companies will make to the health benefits, but there are no citations on their website. There are no studies showing that. So look for the citation. If they list a citation and you want to see it, ask them to send it to you. If they won't send it to you, that's a red flag. If they do then send it to you, then it can get technical, these studies, but if you can verify that the nutrient that was used in the study is the actual nutrient that you're using in their product in the same dose, that's important, because like you alluded to, or like you said, there are a lot of products out there who have subclinical doses. They'll cite a research study, but then they'll use a fraction of the amount that was actually shown in the study to work. So, or you can write and ask them, do you use the amount used in clinical trials? And if they say yes, ask them for evidence for that. So that's one thing. The second thing is looking for the form of nutrients. So specifically the minerals. A lot of companies will use cheap ingredients because they could say, oh, we've got 100 milligrams of, let's say, magnesium in it, or 10 milligrams of zinc in our product. And so that's people look at that like, oh, this is a healthy amount. This is great. But zinc and copper and magnesium and other minerals don't exist by themselves. They have to be connected to another molecule, a molecule that carries them into your intestines, and then your body has to break that apart so that you can absorb the mineral. And many of these companies will use the oxide or sulfate form of the minerals, which are poorly absorbed. So magnesium oxide, for example, when it's in the oxide form, you can only absorb about 2 to 4% of it. So it says 100 milligrams of magnesium in it. You're only maybe getting 2 or 4 milligrams absorbed in your body, and the rest is going right through your intestines and out your poop. So look at those minerals. And if any of them say oxide or sulfate form, it's not a high quality product because you can't absorb those nutrients in good amounts. Then you can look at the manufacturing credentials. A lot of companies, and mine has this, when you look at our manufacturing page, it talks about our facility and the manufacturing third party certifications that we have. So the manufacturing facilities in the US, and that's another thing, make sure it's manufactured in the US and not imported from Asia, because there are studies that have been published that have looked at off-the-counter dietary supplements that were manufactured in Asia, India specifically. They're Ayurvedic supplements, and they went and just grabbed these bottles off the stores and tested, and they had toxic levels of metals, and that's been repeated in different studies. So if it's manufactured in the US, then you know that because the manufacturing facilities have to be FDA registered and CGMP certified, then they have to adhere to specific standards. And one of those is testing for metals, testing to identify the raw material is what we say it is. And then we go a step further, and then our manufacturer has third-party certifications, NSF certified, for example, or even certified by Health Canada, which is a more stringent process than the FDA has for certification. And so you can look at those, and that can give you a level of comfort. Then, if you want, you can ask for a certificate of analysis. So every dietary supplement on the market has to have a lot number on it. And when anybody manufactures a product, that lot number gets stamped on that specific manufacturing run, on all the products, all the bottles from that specific manufacturing run. And what happens, what we do after we're done manufacturing, all of those bottles get quarantined. They don't get released out to the public yet for sale, and they get tested again. So the raw materials get tested before we use them, and then at the end it gets tested to make sure that it's free of bacteria, spores, yeast, and also free of toxic metals, and that it complies with all of those regulations. And then also what's on the label is what's in the bottle, what's in the capsules, because we identify then each nutrient and the quantity on the certificate of analysis, because we pull bottles and open up the capsules randomly and test those. And that every lot then has a certificate of analysis. So if you look at the lot number on whatever bottle you have, there's a piece of paper somewhere or a file in some database that has should have analysis of that lot number before it was released to the public. And you can ask to see that. You can ask before you buy. You can say, hey, can you send me a certificate of analysis so I can take a look at it? I get asked that every once in a while, that somebody will write into my customer service, and we're like, sure, no problem. I love it. I love the educated consumer. I love to help people learn what they can do to be savvy consumers, to get their money's worth and take better care of themselves and their families. And if you ask for a certificate of analysis and a company says, we don't release that, for me personally, I'd walk away.
Mm-hmm.
Why not? Why not share that? What are you hiding?
Mm-hmm.
So that's, at the very least, look for citations, look for the amount that's in the bottle, that's used in the formula as what was used in the studies. And then the last thing I would say that people can look at is look at the guarantees. Do they offer a money back guarantee? And what does that look like? not only do we offer money back guarantee, but on some of our products where you actually get demonstrable results, we guarantee results, which is unique in the industry. So
Hmm.
that's MBI. That's my company. That's what I do. That's I treat people how I would like to be treated. And that is the highest quality and the best benefit that we can give our customers. And that's what I would like to see as a standard in the industry. And so that's what we're doing, leading the way in that.
Those are such good tips for people. I have one more question on that. What about fillers? Are there any ingredients, if someone looks at a label, that you could think of that are like, oof, that one you really wouldn't want to have that in there, and they put it in there for some reason?
So they're two common, not just fillers, but one's a lubricant. So magnesium stearate or titanium dioxide. You also need something to lubricate the machinery as the nutrients are going through it, so it doesn't
Mhm.
gum up and it doesn't cause problems. So I won't use either one of those. I like to use a L-leucine, which is an amino acid, as a lubricant, because if we're going to do something, put it in the bottle if we can, why not give a little extra nutrition? Leucine is an amino acid that our bodies can use instead of something that's either inert, or there are some studies that at least in high amounts it can cause problems. So
Mhm.
L-leucine is totally safe. It doesn't have any of those issues. So we use that as our lubricant in our products. And then as a filler, you'll often see rice powder. That tends to be considered in a rice flour, inert, hypoallergenic. But sometimes instead of that, I'll use a nutritive filler. Like in my iron product, Ferrosol, for example, it's the highest dose ferrous bisglycinate on the market. Doesn't cause GI upset, no cramping, bloating, constipation, nausea, any of that. But the amount of iron in there didn't fill the capsule. So we needed to fill it with something. Instead of using rice powder, I added some glycine in there, 30 milligrams of glycine, because I needed a filler. And people with iron deficiency tend to also struggle with feeling anxious. They tend to go hand in hand. And glycine is another amino acid. It's calming to the immune system. So, it just may help somebody just feel a little calmer too, while we're boosting their iron, while we're improving their iron.
Hmm. Okay, so the two lubricants you said to avoid was titanium dioxide, as well as, what was the second one?
Magnesium stearate.
Magnesium stearate. Okay.
Yeah, which is more of a filler. It's the titanium dioxide that's the lubricant, and the magnesium stearate is more of a filler. The only product that I have that in is my sleep product, magnesium stearate, because it is a tablet. It's a biphasic time release tablet. It's the only biphasic time release sleep product on the market, because people's sleep problems, some people have a problem falling asleep, and then there's the other part of it is staying asleep. And so this targets all of that whole sleep cycle all night. And in order to do that, I had to be able to have the nutrients release in two phases, and both of them over time. And so that technology, that time release biphasic tablet, requires magnesium stearate. Other than that, you will not find that in any of my products.
Hmm. That's good to know. Well, we're coming up on time. Are you open to doing a fun 5-question speed round?
Oh, I love it. Yes,
Okay,
let's do it.
sounds good. So, number one, if you could have any superpower, what would it be?
Oh my gosh. Any superpower, what would it be? Oh, I don't know, because I believe that we all have our own superpowers. I think we all are individually. We have our own superpower, and it's just tapping into that and discovering what that is to release our full potential and joy, and being as vibrant as we can. So
Mm,
I've already got it.
I love that. Number two, what's your favorite hobby?
I love to spend time with my wife. She's my best friend. I love to just hang out with her and do stuff, and it's great with my kids too. We have fun too. But she was around before them, and so and when they leave the house, we're still going to be the two of us. So I guess my favorite hobby is hanging out with my wife. Other than that, people will find me exercising, hiking the hills, and I love cooking. So
Hmm. How long have you been with your wife?
this year is our 20th anniversary.
Oh, wow.
Yeah, I've been together
Congratulations.
23 years, I think 20, yeah, 23 years.
And she's your favorite
23
hobby. That's so sweet. I love
Yeah.
that. What is one supplement that you feel like you couldn't live without?
Right now it's my brain blend product. So it's a formula I created that promotes healthy focus, boosts memory, focus, energy, mood, and recall. And I love that. I take it every day. And so that's the one supplement now for me, the brain blend, that I notice a difference. Like
Hmm.
I'm sharper. My mind is faster. I have an easier time learning things.
Hmm.
And so that's that's the one right now, brain blend for sure.
Amazing. What is the best purchase that you've made in the last year that cost you less than $100?
Oh, wow, what a great question. Best purchase that cost me less than $100. Oh my goodness. I don't know.
Or
Sorry.
did you buy anything this last year that you're like, this was incredible. I'm just so happy that I invested in it, no matter how much money it was. Can take out the 100.
Um, so I just got an electric car this last year, and
Okay.
I love it. It drives better than any gas car I've had, and it feels good to not be polluting the environment. And so I think that's probably the best purchase but definitely more than $100. I wish
Yeah.
it were $100.
That would be something. All right, final question. If you could leave the listeners with one tip that they could implement this week to help them live a healthier, happier life, what would that be?
Fall in love with the process. When you have the right process, the results will take care of themselves. And make personal development, make health not about the outcome. Have a vision for yourself, know what you want, how you want to feel, but make the activity of learning, make the process of improving your health, make the process the goal in and of itself.
Hmm.
And if you do that, you will never plateau.
I think that's so important for our happiness, right? Because otherwise, we're just kind of always in that mentality of, oh, yeah, when I achieve this goal, I'll be happy and satisfied. Or when I buy that new car, or do that thing, then I'll be satisfied. But the
Yeah.
truth in the studies show that that's not true,
Or
right?
people say, I've just got to get down to X weight. I've just got to
Hmm.
get to this weight. And then what happens? They get to that weight, and then their brain's like, okay, I've made it. I can stop. And then they just yo-yo back up
Yeah.
instead of, how do I want to feel? Like for me, I have a very distinct, very clear vision of how I want to be as I age and as I get older. I want to have energy. I want to be excited. I want to have my flexibility. I want to be able to be as active as I want to be without limitations. I want to continue to have great sex. And I want to wake up and be excited by what's in front of me.
Hmm.
And everything, it's like, okay, that's the rest of my life. That's not, I get there and I stop, but what can I do? What can I continue to learn? And the learning part of it to me is what's so exciting, is
Hmm.
learning how my body works, learning what my body needs, tapping into that and honoring it. Too often I think people get sidetracked because there's this mentality where they get around other people, and research has shown this, where eating poorly is contagious. You're more likely to eat unhealthy or to be obese if you're around somebody who's obese. So despite the fact of the peer pressure of people eating fries, and hamburgers, and I'm not opposed to that as a treat, but people can indulge in that too much, is just knowing what you want and knowing it's okay, and despite what people say. Because if anybody has a problem, the problem's not you, the problem is with them. If somebody's not supporting you, and I guess that's another thing too, that's a bit of a pet peeve of mine. My wife and I, years ago, we sat down and we made a conscious decision together that anyone who is in our life who doesn't elevate us or lift us up like we do that for everybody in our life. We want to lift them up and elevate them. If they're not doing that for us, if they're negative, if they have
Hmm.
energy and comments that are cutting us down, we're done. We're out. We cut them out.
Mhm.
And maybe we had a conversation with them and shared with them, gave them a chance to change. But now, if and I recommend this to people, surround yourself with people who help elevate you and build you up and help you become a better person.
Yes, that is such a good tip. I share that with my clients as well. Make a list of at least the 5 closest people to you, kind of like Jim Rohn says that, right? You're the product of the 5 people you spend the most of
Yeah,
your time with,
absolutely.
including your nutrition and health and everything, right? Not just the way you speak or how much money you make or what your health is like. And so, yeah, taking that inventory periodically and asking yourself those questions is so, so important to propel yourself to be the person that you want to be. And also, I encourage people to ask themselves, am I uplifting and motivating? And am I helping support other people towards their goals as well? Right. So being that mirror reflection of who you spend your time with.
I
Um,
love that. I love that. And the fact is that we tend to attract the energy we put out anyway.
yes.
So I love that. I've never heard that before. And if you don't mind, I'm going to borrow that. That people need to look in the mirror, and ask them, are
Yes.
they doing that? Are they modeling that behavior? We're going to attract the people into our lives based on the energy that we're putting out there. So I love that you do that with your clients. They're lucky to be working with you.
Thank you. Same to you. Well, this has been such a good conversation. I'm very, very happy that we got you on the show and we're able to dive deep into the osteoporosis topic. And do you want to share, where people can work with you or any last comments before we go?
Yeah, so you can find out more about my work and the products I created in the book at nbihealth.com, nbihealth.com. And also all the links to social media and all that is on there as well. Lots of free resources, blogs, articles that people can dive into if they want to learn more about any of the topics that we've discussed here.
Perfect. I'll put that all in the show notes. Thank you so much, Dr. Neustadt.
Thank you. Thanks.
Thank you so much for watching this video. Don't forget to like this video and comment, letting me know what you enjoyed and what you want to see more of. Also, please subscribe and hit the notification bell so that you get alerts when new content is coming out and you don't miss any videos. And just a quick reminder that this information is for educational and entertainment purposes only. It is not intended to diagnose, treat, or cure any illness or medical condition. Please consult with a qualified healthcare professional before making any changes to your diet, exercise routine, supplements, or medical treatment. If you're looking for a functional medicine practitioner, please reach out to me. And thank you again for watching, and keep striving to become your healthiest, happiest self.